mammography, we know that it's not perfect. We know that you can have up to 40% of cancers can be missed in very dense breasts. So we have tried to see other methods that will be better than mammography, in a sense that maybe methods that do not need radiation, methods that do not need contrast, methods that don't care about breast density, that look into breast density better. So there are some methods which we think can improve the data from mammography screening. One of those methods is tomosynthesis, which is also radiation modality, but tomosynthesis has the advantage of doing a scan of all the breast and reconstructing the image every 1 millimeter. So the superimposition of images that will preclude you from seeing the cancer if it's surrounded by normal tissue, you don't get that with Tomo. You can see the cancer straight away because you're, so to speak, cutting through the breast every 1 millimeter. Tomosynthesis has already been used in screening, especially in Europe, in prospective trials, also in retrospective trials in the USA, and the results are very, very encouraging because it not only detects 35% more cancers, it lowers the recall rates. That means it is more specific. It's more specific than mammography. The other method would be ultrasound. Ultrasound has been used every day. We use it every day to characterize lesions. If you use it for screening, it has a 3 per 1,000 detection rate, which is not bad. But the problem with ultrasound is that it's time consuming. You have to spend minimum 20 minutes to do a very good ultrasound scan. And the problem is also that it has a very low positive predictive value. You get many more false positives in ultrasound than in mammography. And the third method we're talking about is MRI. MRI with contrast has been used and is being used as a method to screen high-risk patients with hereditary risk greater than 20%. And there have been some advances in this field because some people are now proposing an abbreviated MRI method, which would mean less time to do the MRI and less time to read it. So far, the information we have is just feasibility studies, retrospective, but they are encouraging. And the other method I talked about is diffusion MRI, which is an MRI that doesn't need any contrast. And we are now working on that, and the data are only theoretical at this moment, but the data are also very encouraging because it doesn't need contrast, it doesn't care about breast density, and it doesn't hurt the patient in any way. It's not a radiation exam.